pathology of deficiency anemias, mainly iron deficiency, megaloblastic, and briefly anemia of chronic disorders. So if we know the classification of anemia, the decreased production, the top 6 anemias, the 2 deficiency anemias, 2 deficiency of blast cell anemias, and 2 hemolytic anemias. Out of this, I'm covering the 2 major, the iron and megaloblastic, and then anemia of chronic disorder and aplastic anemia briefly. Okay, so just to recapitulate, the RBCs are produced through maturation of erythroblasts, gradually losing the nucleus and dividing multiple times, finally giving rise to RBC. For this, the 2 important nutrients for the DNA is B12 and folate. Both of them are important for DNA metabolism, production of DNA, and you have to read the metabolism of both B12 and folate, the R binders, stomach, intrinsic factor, colon, so all the physiology, okay, and that results in DNA synthesis and cell division. Deficiency of that causes megaloblastic anemia, okay, and the more common clinically, the iron deficiency anemia, which is necessary for the hemoglobin production in the cytoplasm. So DNA for the nucleus, hemoglobin for the cytoplasm. So for the hemoglobin, read the iron metabolism. And the second group is deficiency of blast cells themselves. Either the blast cells are there or blast cells are destroyed. Even if they are there, they are not dividing. That is aplastic anemias. Dysplastic anemias, leukemias we will cover later. So now only understand the aplastic anemias. So the deficiency of nutrients, the 2, and the deficiency of the blast cells, okay, and that also covers anemia of chronic disorders. What we are not going to cover is hemolytic anemias, okay, that we will cover later. So to better understand, I am covering together both iron deficiency and megaloblastic anemia. The commonest cause of iron deficiency is bleeding. Loss of iron is from the body is the biggest loss for iron stores because very limited absorption. So when you read iron metabolism, you will understand that iron has no good mechanism to absorb as well as excrete. So the major source of iron for routine use is recycling of the RBC. So bleeding is a big problem for the nutrition, that is iron, and commonest cause of iron deficiency is bleeding, loss of blood. Occasionally it can be due to nutrition, increased needs during physiological growth, childhood, pregnancy, but in most of these cases also you should exclude bleeding. So bleeding is the commonest. Pathogenesis, decreased iron, decreased hemoglobin, and excess cell division because there is normal DNA leading to small RBCs. Morphology, microcytic, that is small RBC with less hemoglobin, hypochromic. And due to unknown reasons, the elongated RBCs are a result of iron deficiency known as pencil cells. Clinically, the iron is also necessary for fast dividing cells such as epithelium, and there is damage in the epithelial tissues, glossitis, cheilitis, stomatitis. Koilonychia is a little more characteristic, seen typically in only iron deficiency, not in megaloblastic, whereas all other features are seen in megaloblastic as well. Dysphagia is usually due to epithelial disintegrity in the esophagus. In fact, it can cause even esophageal strictures, Plummer-Vinson syndrome. Now, megaloblastic, major cause is nutrition, that is decreased by B12 or folate in the food, or antibodies, or damage to the absorption apparatus, the gastrointestinal disorders, gastritis, intestinal disorders, surgery, blind loop syndromes, chronic gastroenteritis, inflammatory bowel disease, malabsorption syndrome, and in addition, cancer therapy. Cancer itself, when it is fastly growing high-grade cancers, utilize all the available B12 and folate, and patients may suffer from deficiency. But most important is many of the anti-cancer drugs are also inhibitors of folate, because folate is necessary for cell division. What is the pathogenesis? So both vitamin B12 and folate are necessary for DNA. So please read the normal metabolism. So there is decreased DNA, and that leads to decreased cell division. So that results in fewer number of larger cells. And because it affects all the cell lines in the bone marrow, typically in a megaloblastic anemia,